Well, Teresa, you brought your child with you today, and he's had several birthdays in the other room while we've been recording.
Wait, no,
he's right there.
We'll bring him in at the end.
Okay,
right?
you can tell me he was here.
Yeah, he's in the other room playing on a game, and it better be one of those, massive epic scrollers that they'll take him forever to get through. Do you have time for one more topic?
Sure.
Okay, let's do this then.
For up-to-the-minute reports, stay tuned to this station. Now the news.
The topic we're going to close with today involves Medicaid and Medicare cuts. We have in the studio with us two individuals who live in the world of medical services. Teresa talked about it a bit already with the community initiatives and the La Clinica Gratis program. And Jamil, you also work in the healthcare industry, right?
Yeah,
what
the
do you
Nest
do?
Home Healthcare.
That's right. And both of you, do you get involved with Medicaid, Medicare?
Yeah, Medicaid is a big funder for me.
Right, and we don't.
Well, in any event, it all is about healthcare services, which is near and dear to all of our hearts. But one thing I always get confused by, I just want to start off with, is what's the difference between Medicaid and Medicare? How do we get them straight in my head?
I like to say you care for the elderly and you aid everyone else.
So it's care for the elderly and disabled.
Yes.
Right? And then it's aid for the poor, right? For everybody who can't afford healthcare.
But some people can have Medicare and Medicaid.
And they can have both. Okay. Yes. But I use them almost interchangeably, like they're synonyms, and they're not.
And
they're very
not.
different programs.
Yeah.
Well, we've had this thing they called the One Big Beautiful Bill Act that had passed over the summer, which absolutely guts Medicaid and Medicare. And according to one article from the Center for American Progress, they said that those who need Medicaid the most, you aid the poor, right? Those who need Medicaid the most, including people with disabilities and the elderly, will be affected by the bill's cuts. The nonpartisan Congressional Budget Office estimated that this bill will cut federal spending on Medicaid and Children's Health Insurance Program, CHIP, benefits by $1 trillion due to eliminating at least 10.5 million people from the programs by 2034. Research shows that when federal funding for Medicaid decreases, guess what happens then? States start to cut as well.
Yeah.
So these optional benefits such as home and community-based services, these HCBSs, they get cut first, and then it doesn't just affect those who need the services. Now you're also talking about these cuts affecting hospitals, closing healthcare facilities, workforce layoffs, etc. So this is absolutely nuts. Here's one study that said that there's a waiver you can get for these HCBS services. It says that the funds from this bill would only be able to cover these costs for about 27 people per state.
Good God.
Per state. Like that's what the federal government's willing to kick in if you give a waiver. 27 lucky people in a state would get this federal funding. Before I go into much detail, I do want to play a video of somebody I thought did a fantastic job countering the Republican claim about the Medicaid cuts in this bill, where the first voice you hear is somebody who says, this isn't bad at all. And then the second voice is the fact-based voice that's going to say, listen, this is where you're wrong. This is why it's a problem.
Okay.
They're framing it like he's just snatching 12 million people's health coverage away for no reason, when what's really happening here is Trump introduced a work requirement saying that before you can receive health coverage free of charge from the government, you have to work at least 80 hours per month.
This figure breaks down adults on Medicaid by category. There are only 4.3 million people without one of the documented exceptions he's talking about. Only 4.3 million able-bodied adults who aren't working who are on Medicaid. So you really can't cut 12 million of those people because there aren't 12 million. And when you look at adults on Medicaid who aren't working, you see it's mainly older people. So if we look at men specifically, women are disproportionately involved in childcare. If we look at men specifically, we see that young men have employment rates of about 90%, and that falls off as they get older. You could imagine a man who's worked construction his entire life, as he hits his late 50s, early 60s, it's hard to keep doing that work. And he may have medical problems that don't quite qualify him as disabled, but do make it hard for him to work, and he needs insurance. That aged construction worker would be one of the 4.3 million. One of the free riders this guy says we should kick off of Medicaid.
you have to work at least 80 hours per month. That is a whopping 2 weeks of full-time labor out of every month. These are meant to be social safety nets, not forever and ever gravy trains that you can just ride while refusing to work.
I'm not sure how he thinks Medicaid works, how it could be a gravy train that people are living off of. Medicaid doesn't give people money. If you are low income, Medicaid will pay for your health care because you can't afford to pay for it. Remember, only 4 out of 12 million people who he wants to take health care away from fit the category he's describing. Only 4 out of 12 million people are healthy and not working. It costs very little to give those people government health insurance because by definition, if you're healthy, you don't need that much health care. You're healthy. Median beneficiary spending in this category is only $142. If you're a 35-year-old man, loser, in your mother's basement, healthy, you don't go to the doctor that much. You don't spend that much on healthcare because you're healthy. There's a higher average spending in this category, which implies to us that some people in this category do need a lot of healthcare. And if there are a few outliers that drive the average up so much higher than the median, that should imply to you that there are some people in this category who aren't that healthy. And he thinks we should take their health care away. I find it frustrating that his logic doesn't even make sense. If they are healthy, they're not spending any money because they're healthy. If they're not healthy, maybe it makes sense to take care of them. I can see the cold economic appeal of what this guy is saying. Hey, if we take away people's health insurance, we're likely to motivate them to work, and we'll save money by not providing them health care. But I get frustrated when people like this guy pretend to have an underlying philosophy, but really what they're doing is just saying whatever might be useful to defend whatever Donald Trump wants to do today.
That's it right there.
Yeah, that's it right there.
As they say in the kids' vernacular, the math ain't mathin'. Right? Isn't that what they say?
But I tell you what is mathing. For free safety net organizations like ours who already have taken massive losses, this is going to cause more people to be uninsured, more people who cannot afford plans like the Affordable Health Care Act. And this is going to bring more people to the doorstep of us safety net clinics. Medicaid, we don't accept it because, you know, we are serving those who fall between the cracks. So you don't have coverage, or you have a small amount, like a family planning Medicaid that only covers you for something like birth control, right? Those folks can come to us. What this is going to do is increase the numbers of people who have healthcare concerns that are costly, who no longer have coverage, and they're going to need care. We're going to literally lose people. We're going to have people dying unnecessarily because they can't get care. And they're going to come to the already stressed out nonprofits and safety net medical providers. And we're going to try to do everything we can to give them care with the less resources that we now have. And we're going to try to save people's lives as we've been doing since we've, started this work. And you're going to have people like this saying, hurt more people.
Yep.
Because that's exactly what this is.
That's what that is. And we'll go even further and say, like, from a Medicaid standpoint, I can already tell you, like, I have clients that are needing more hours, but they can't get more hours because per county, the funds have already started to be impacted.
Exactly.
So you have people who are bedridden in their homes that they most likely own because they're elderly. And I think that is a reversal of the system that will end up, if you owned a home and you're trying not to go into a nursing home, you're trying to hold on to your own property, you will lose your Medicaid. And what's going to happen is you're going to have to come out that home and end up in a nursing home.
But you can't afford the nursing home.
You can't. So you've lost your home and you've lost your health care.
Yep.
It is a domino effect.
Now, do these include the patients that were watching Fox News when you walk into the room?
No, they cash paying.
Well, one of the ways that this bill is going to implement these cuts are through, and you heard a little bit here, work requirement provisions.
Yeah.
So somehow we've got it in our society that your health, your ability to seek care, if you've had a heart attack or you have cancer or diabetes, is you have to be a half-time at least working individual. Like there's a link there somehow that was invented that I don't know why. I mean, I can use the roads outside and I don't have to be working to prove that I can use the roads. There are certain services, I think,
but
like health.
I'm glad that showed, because your question becomes like, that's why I don't like 60-second clips or minute clips, because you ain't, and I don't like headlines because you ain't getting what you need in here. But when you're looking at this, what percentage of the Medicaid recipients are actually not working?
Yeah.
Most are working and working multiple jobs
to survive.
To survive, or they're not doing it. There is a clear pattern of ignorance that goes along with people who are not in these positions, who don't know these folks, who don't work with them, who don't care for them, but they have a very ignorant view of saying people need to get up and, pull themselves up by the bootstraps.
But you got to have a boot.
And you got to have a boot. And here's the other thing. They're pulling themselves up without the boot, but they're pulling you along and taking care of you and putting money in your pocket, because most of the jobs they're doing are creating revenue for other people and it's not creating revenue for themselves.
Oh, that's good.
So what we have to do is stop believing the hype and the thing that has been said and told, because again, I go back to history and I go back to education. If you really look at it and educate yourselves, it is not true. And so we have a large amount of people who believe these things, and they're not true. They're not just, and they're not even close to hitting the mark.
No.
And we are going to be killing people.
It's not even an opinion, because this whole concept of work requirements has been implemented in certain states throughout the country already. So you can look at the impacts. And according to the Kaiser Family Foundation, implementing work requirements on a national scale, requiring states to verify individuals' monthly work status at least every 6 months, and implementing a long list of exemptions are policies that proved challenging for, guess which state? Arkansas. They tried to operationalize that, and it led to 18,000 people losing coverage in Arkansas. Now, you're telling me that those were 18,000 freeloaders working off the gravy train of Medicaid? Again, as we saw, it's not a gravy train. You only use it when you're ill. 18,000 people could not get the medical coverage they needed in Arkansas. So now you take that brilliant plan and apply it nationwide.
Well, I'm glad you brought up, and I'm going to jump in here, the Kaiser Family Foundation, because I also looked at some information from them, and there's a coverage gap, and they are estimating that there are 65,000 people, adults only, not even talking about children, in South Carolina that are going to lose that coverage gap, and they're going to be too poor for marketplace subsidiary, and they're going to have ineligibility for Medicaid, and they are going to be, they're already under the state rule, but they're going to lose additional coverage. So you're talking about 18,000 in Arkansas. Let's talk about the 65,000 here in South Carolina.
Yeah, but that's why you got to protect that CHIPS program.
Yeah.
And they after it, and they are going to wipe the CHIPS program out. They don't want it to be called, I don't care who you call it, Obamacare, somebody care, but that needs to be in existence because of those gaps. That we're going to have that provision, and so many people will go. And if we're truly concerned about the health of our state and our nation and the educational levels of our state and our nation, don't you know that a sick body is not an able body? You got to be healthy in order to go to school and learn.
Right.
I don't care how good the teacher is. And you got to be healthy in order to come on these jobs and stay here and work. I don't care how great the pay is. If you are physically unable to work because you don't have access to health care, you're going to be doing the opposite. You're going back to where they're trying to pull you from. Give the people the health care and the resources that's necessary. Maslow's hierarchy of need.
Oh, stop. Yes. You bring that up every episode.
Because it matters.
And because it's true.
And we're going to
be Black, White, and Maslow in the South.
Put them in there. We got to get that trademarked. Put them in there.
Well, that last clip I want to give credit to came from a TikTok account called I Think So. Didn't give his real name, but I have a link to that in the show notes. This next clip is one that explains how these Medicaid work requirements actually happen. This came from Seize the Means Shirts on Instagram. Let's take a look. Now, he play acts.
Okay.
He does two roles. He talks about somebody who's being forced on these Medicaid work requirements, and then the Republican lawmaker who's imposing them.
Okay.
So let's hear how they play this out.
You want Medicaid? Just fill these out. What is this? Work requirements. You only get Medicaid if you work. I do work. You can't work too much. What's too much? Well, if you make more than $27,000 a year, you don't qualify, which I know it's not enough to live, but I don't make the rules. You do make the rules. Oh, yeah. Well, better get to it. Those forms aren't going to fill themselves out. I need to prove I worked 80 hours, and every hour needs to be proven individually? How am I supposed to piece my life together like this every single month? Well, you only got to do that if you're within a certain age group. Which age group? 19 to 65. What? Okay, I do contract jobs, so my hours are inconsistent. Too bad. Well, what if I work 85 hours this month, but I only get 75 hours of work the next month? You're out of luck. No averages. So if you can't complete the 80 hours, you're just gonna have to fill these out. More forms? Yep, more forms. Oh my God, why is this so confusing? That's the point. It's really hard to tell if I'm exempt or not, and I'm sure it's gonna be for anyone that's between jobs or self-employed or does gig work. Tell it to somebody who cares. What about my friends who are caregivers of children or pregnant? What about people with disabilities? Shouldn't they be exempt? Yeah, they're exempt. But they're gonna have to prove it to us. How? More paperwork, of course. Well, what about if they don't realize they're exempt or follow those steps? Yeah, that happens all the time. Hold on, I'm reading here that over 90% of Medicaid beneficiaries are already working or exempt. Did you know that? We did know that. But this is gonna make so many people lose benefits just because they can't jump over these bureaucratic hurdles. Yeah, probably like 7.7 million. Why would you want to do that? Because we want to boost employment. Is there any evidence that work requirements do that? Nope. So you're just cutting Medicaid. Okay, it may seem like these are Medicaid cuts because so many people will be cut from Medicaid, but if you work, you're fine. Here are all my forms. You are not fine. Why not? Well, you need to verify your address and your income every 6 months, and you just missed the window. So you're cutting my Medicaid even though I work just because I didn't get my paperwork in on time? Wow, when you put it that way, I guess we are cutting Medicaid. Oh well, at least our donors are happy. Next!
Every one of that's based in fact, reading this bill.
That's why they want to keep the population uneducated.
Mm-hmm. Well, here's the kicker, and I'm going to conclude with this thought. All of these changes that we've talked about, all this discussion, doesn't even kick in until after the midterms next year. Did you know that?
Yep.
So these work requirements, this paperwork, all that stuff happens after the November elections of 2026.
Yes.
Because if they were implemented today,
they wouldn't make it.
It would be a riot. And they knew they
you
would
know
lose
what that
it.
shows you?
Think about that.
They shows you that they know exactly where the majority of the benefits are going.
Yeah.
They know the breakdown of the benefits, so they can't do it now because if they do it, Republicans who've traditionally voted Republican will change because they see how it will impact them.
If there was such widespread abuse and such opportunity, why wouldn't they implement this as fast as humanly possible? But no, they timed it for after the election because they know exactly what's going to happen when this kicks in.
Gosh.
Scary stuff. Scary stuff.
Indeed.
And if you had just the iota of thought process, you would figure this out.
Just a tad bit.
That's all.